Press and piezo microsurgery, Bonnie led. A 7-year evaluation in residency program, part 1, surgeon defined site location. This done by Niemczyk et al. And published in the GOE 2022. In challenging clinical scenarios, especially posterior surgical site with thick cortical plates, the Bonnie lid technique allows for unhindered operational visibility without sacrificing post-operative protection and regeneration. Sharing one of these case reports, which done on tooth number 19. A full circular incision was made from the distal tooth of 18 to the mesial tooth of tooth number 20 with a vertical release incision at the mesial line angle of 20. A triangular flap was reflected and the mental nerve foramen was located, marked with methylene blue dye and isolated via retraction. The site of the lid was determined and primarily level of the superior margin of the lid was measured and marked. A shallow score mark in the cortical plate was created using the piezo saw tip, and the score mark again was filled with compact piece of gutta percha. A radiograph was exposed using parallel technique to minimize parallel errors, and the height and extent of the gutta percha segment was noted. The length of the gutta percha segment was known, and this facilitated the calibration and accuracy of the subsequent measurement. The adjustment to the apical coronal height angles on both roots were made relative to the score mark by the gutta percha on the cortical plate, and the outline of the lid was plotted accordingly to the virtual surgery blueprint. The initial outline of the lid boundaries was made using the piezo saw tip to the depth of 1 mm with a final separation incision using the scalpel tip. With a copious irrigation, the scalpel tip produce a much narrow incision in the bone and improve adaptation of the lid post-operatively. When transition through the cortical plate into the cancellous bone was relied circumferentially in the lid incision, an evaluating instrument, which here they used the Rodel curette, was inserted into the superior and inferior cuts and luxate alternately until the underlying cancellous bone fracture. The lid dislocated and delivered from the site. The lid was examined for any incomplete or green stick fracture and placed into sterilized basin containing 0.9% sterilized saline for hydration replacement. The mesial and the distal root apices were located and isolated, and any hard soft tissue removed to enable resection. A biopsy of the soft tissue lesion attached to the distal root apice was taken out and sent to the oral pathologist. The mesial and the distal root apices were resected 2 to 3 millimeters respectively using the scalpel tip, and the resected surface were examined for extent and completeness using low high power with direct and indirect means. Then the resected end were prepared using the ultrasonic root end preparation. Preparation examined with micro mirrors for extent and centering. The preparation then will filled with BC putty. The excess material was removed from the cavo surface of the preparation and the radiograph exposed to confirm placement and complete of the root end filling. Calcium sulfate was mixed and placed into the depth of the crypt allowed to set and carved back to depth to support the lid. The lid was removed from the sterile bath and replaced into the site with former orientation. The incision gaps were sealed with additional amount of calcium sulfate to seal and stabilize the lid, as we can see here in picture K. The soft tissue flap was cupped and allowed to perfuse with hydration around 5 minutes. Closure was achieved and then sutured. Two radiographs from different horizontal angles revealed the density and the presence of the calcium sulfate and relocation of the bony lid, as we can see here. Post-operative instruction and antibiotic with analgesics was prescribed. A telephone call at the night to the patient found that the patient is resting comfortably, and she present 5 days later for suture removing. Healing was uneventual and post-operative instructions were reinforced. She subsequently present for periodic recall, and the last one was 48 months and revealed the site completely resolved in 2D and 3D imaging.